Believe it or not, I haven't. I've never gotten stung by a bee until I had it on my way to Mount Whitney, which is like hiking 14,500 feet. So not pretty, but something to learn. And I want to share how these bee sting can cause instability in your body.
An allergen is an irritant that causes an allergic reaction like the bee sting, snake, dust, pollen, etc., causing a local or systemic reaction to your body. There are different types of the immune systems or your body's reaction to an allergen. There are local and systemic.
You don't know for sure at the very beginning if you're allergic to the venom of the bee, and you don't know what kind of bee it is. So the effect of the bee venom can either be local or systemic reaction. So local presents as like a redden in the area, person experiences itchiness and can persist for like 3 to 4 days, which is called a local reaction. And then the allergic reaction, which is the immune response, is revved up. So the response to like an allergen, which is the bee sting venom, pollen, for instance, is another example. So the allergen, what it does is that it revs up your body, which is called the mast cell. The effector cells, or the mast cell, they release histamine, and this histamine, to make it easier for the rest of the immune system where the attack is, and they dilate the blood vessels that is leaky to become more effective. So you'll see all these raised bumps on your skin. Other immune response is a systemic response besides the local, and that can be useful also or can't be useful to your body.
Systemic reaction is the anaphylaxis. Symptoms include flushing, which is warmth in your face. Urticaria is having those bumps on your skin. Angioedema is the feeling of your throat getting swollen, and then itchiness. And then you have swelling, and then all the respiratory symptoms like congestion, throat tightness, which is the angioedema, chest tightness, wheezing, when you breathe, shortness of breath, coughing, and hoarseness. And then the cardiovascular part is you feel dizzy, weak, chest pain, feeling like you're going to pass out, fast heart rate, which is palpitation. Gastrointestinal is that you're not able to swallow, you're nausea, you feel that you're going to vomit, you have diarrhea or liquid diarrhea, bloating of your stomach, abdominal cramps. And then neurological is headache, syncope, and feeling of an impending doom. After ruling out all the basic risk factors of the pulmonary embolism that I got during the hike, it was concluded by my physicians that it's not definite that it was caused by the allergic reaction to the bee sting. However, it can be a possibility. The two cases that I'm showing you here is that pulmonary embolism can present with a lab value called the D dimer that usually shows that you have pulmonary embolism or blood clots in your lungs, and confirmed by spiral CT angio, which is a picture of your lungs via an imaging study. And so there is this first case where a woman got stung by a bee, and it was concluded that they thought she had pulmonary embolism. The embolism was caused by the allergic reaction from the bee sting. And then a second case is a nickel allergy. It was made a case study where the patient had a allergic reaction showing the lab value of a D dimer being elevated, confirmed by spiral CT. The final diagnosis was allergic reaction to nickel. As the medical community says, medicine is not an exact science. In my case, I had a perfect storm, an altitude with an elevation of 14,500 feet, and combined with the bee sting, allergic reaction to the bee venom, and dehydration, led me to have this phenomenon of pulmonary embolism. If there is a allergic and or anaphylactic reaction, the common treatment is, of course, remove the trigger, antihistamines like Benadryl, H2 blocker like ranitidine, consider steroids like prednisone, and of course, if you're having this allergic reaction, seek medical attention right away. I suggest to plan for your next hike. When you're planning for your next hike, bring satellite phone with you, an EpiPen, usually prescribed by your physician, and an antihistamine in your bag, which is Benadryl.
Have fun, you guys. I'll see you in the next adventure.